Witnessing a loved one experience sudden, unexplained episodes of unresponsiveness is unsettling. When these episodes involve unusual movements, worry often escalates to fear. This is the situation facing many families with aging loved ones. Consider Diana, an elderly woman with Alzheimer's, a previous stroke, and atrial fibrillation. She is on medication for these conditions.
Recently, I've observed my mother experiencing episodes of staring blankly. These episodes are coupled with repetitive mouth movements.
The daughter's worry is understandable. These descriptions raise a red flag for a doctor. The combination of unresponsiveness, staring, and repetitive movements suggests seizures. Seizures manifest in various ways. Some people experience dramatic convulsions. Others, like Diana, might exhibit subtle signs. These subtle signs can be mistaken for something else, especially in elderly patients. The daughter's observations are crucial. They provide valuable clues for medical professionals to determine the best course of action. Based on the daughter's account, seizures are a strong possibility for Diana's episodes. Seizures occur when there's abnormal electrical activity in the brain. This irregular activity disrupts the brain's normal function. Diana might be experiencing focal onset-aware seizures. These seizures affect a limited brain area, causing specific symptoms.
Her repetitive mouth movements suggest involvement of the brain region responsible for facial movements.
Diagnosing seizures and ruling out other conditions require a multifaceted approach. A doctor will start by taking a thorough medical history, considering Diana's age, pre-existing conditions, medications, and any recent illnesses. An electroencephalogram, or EEG, is a crucial test in this situation. The EEG records the brain's electrical activity, much like an electrocardiogram, or EKG, records the heart's electrical rhythms. By capturing brainwave patterns during and between episodes, the EEG can reveal telltale signs of seizure activity.
Blood tests are also essential. They can help identify metabolic imbalances, infections, or medication levels that might contribute to Diana's symptoms. For instance, electrolyte disturbances or low blood sugar can trigger seizures. Brain imaging, such as a magnetic resonance imaging or MRI scan, provides detailed pictures of the brain's structure. This imaging can detect any structural abnormalities, such as lesions, tumors, or evidence of previous strokes that could be causing seizures. Whether Diana needs immediate hospital admission depends on several factors, including the frequency, duration, and severity of her episodes. If her episodes are prolonged, occurring frequently, or causing significant impairment, hospitalization may be necessary. The hospital setting allows for close monitoring of her condition, especially if further testing or treatment adjustments are needed. Additionally, if Diana experiences a seizure that lasts longer than 5 minutes, or if one seizure follows another without regaining consciousness, it's crucial to seek emergency medical attention. However, if her episodes are infrequent, brief, and not causing major disruptions, outpatient evaluation and management might be appropriate. The decision should be made in consultation with her doctor, considering the potential risks and benefits of each option.
Several factors increase Diana's risk of developing seizures. Her history of stroke is significant, as strokes can leave behind areas of brain damage that are more prone to seizures.
Similarly, Alzheimer's disease is associated with an increased risk of seizures. Atrial fibrillation, a heart rhythm disorder, can also increase the risk of stroke, which, in turn, raises the likelihood of seizures. It's essential to ensure Diana's atrial fibrillation is well managed to minimize this risk.
Medications, especially certain antibiotics, can lower the seizure threshold, making someone more susceptible to seizures. A thorough review of Diana's medications is crucial to identify any potential culprits. Furthermore, aging itself is a risk factor for seizures. As we age, our brains undergo natural changes that can increase the likelihood of seizures, even in the absence of other medical conditions.
Diana's situation highlights the complex medical challenges many families face as their loved ones age. The possibility of seizures adds another layer of concern. Open communication between Diana's family, her doctor, and other healthcare providers is paramount.
Once a diagnosis is confirmed and the underlying cause is identified, a tailored treatment plan can be developed. Medications, lifestyle modifications, and ongoing monitoring can help manage seizures and improve Diana's quality of life. Equally important is providing emotional support for both Diana and her family. Coping with seizures can be emotionally taxing, and having a strong support system can make a significant difference. Remember, seeking help and information is a sign of strength, not weakness.